Okay, this lecture we're going to be talking about caring and communication and your role as a technologist in these areas here. So what is caring? It's a function in which a person expresses concern for the growth and well-being of another in an integrated application of mind, body, spirit designed to maximize positive outcomes. So what is empathy or empathetic care? A constructive response with objectivity that allows the imaging professional to provide high quality of patient care. So empathy is not sympathizing with or feeling sorry for the patient. So uh, it's really important that you don't dive into, oh, I know it's so horrible. Instead, say, I understand, Mr. Jones, that this is very difficult for you. So there's a big difference between the two. I'm really sorry that you're, having a hard time, and is there anything I can do to help you? Instead of, oh, I know it's so painful. So there's a big difference between the two, and it's really important that you jump into an empathetic role with the patient. If you go into a sympathetic role with the patient, you might be stuck there forever with the patient. So in order to provide really good care, you have to jump into the empathy and the empathetic care. Okay, so activities classified as caring include, so listening, providing information, helping, communicating, shadowing or showing respect, touching, careful touching, nurturing, supporting, and protecting. So care is an ideal and analogous to beauty, truth, and justice. Although it is sought after, it can never be fully attained or perfect in the human expression. So imaging professionals are not capable of providing perfect care. It's hard. Every patient is very different in their needs. So we strive for giving perfect care, but it's really difficult to actually succeed in that. So the empathetic imaging professional is sensitive to the needs of others and strives to meet those needs. The connection must not be merely be a reaction to the patient's distress. So it's really important, like I said, that you're empathetic and you do the best that you can to provide the best care for that patient. Will it be perfect? No, but darn close, right? So there's a lot of obstacles in providing care. So there's a lot of time constraints, there's technical issues, sometimes with the machine, sometimes not, sometimes with the patient, the impact of your personal life or their personal life, the lack of training and caring for patients who are critically ill or terminally ill is, it takes special skill sets. Lack of communication, so that's really important, and that can really hinder the care that you can provide for the patient by not communicating properly or the patient not communicating with you properly. Societal pressures and lack of faith in self. So if you're insecure, that can really put obstacles to your caring, or even the patient if they have lack of faith in themselves. I don't think I can do it. I can't do it. I can't do it when they're already doing it. So, words of encouragement is sometimes needed there, both ways. So, professional care, it's characterized by the application of the knowledge of a professional discipline, including its science, theory, practice, and art. Imaging professionals also show caring for their patients by ensuring confidentiality, that's a big one, obtaining informed consent. Yes, you are supposed to protect the patient, that was one of the things. Thoroughly explaining the procedures, yep, and completing accurate histories. There is no box 3-1, sorry. The professional human caring practices by imaging professionals is based on individual and institutional values. So your values and the values of your institution in which you're working, that will come through. So as caring. So a lot of the times I work at a facility that's very busy, but whatever the patient needs, we do. So if it takes 3 hours to do a chest x-ray, that's extreme. Then it takes 3 hours to do the chest x-ray. If I'm using 15 blankets on a patient, it's fine. So it depends on where you're at. Careful monitoring of the radiologic equipment is another activity that shows caring by ensuring autonomy, comfort, and safety for the patient. So that's another way that we show that we care, by keeping it clean, well-maintained x-ray rooms. Developing a more caring demeanor. So methods of increasing your caring skills. So communication is important, so you can work on your communications. There's classes that can help you with that. We want you to start to critically think. There's classes for that too, so that you can start thinking outside the box so you can provide better care for your patients. Discussion of films that illustrate caring. So that's interesting. Empathy rotations. So a lot of the times, if I have a technologist when I was in management that really couldn't figure out this empathy thing, I'd put him in a fast-paced environment with really sick patients. And they usually broke and became empathetic. So if they were sympathetic, they knew that they could not dive into that. They had to go to an empathetic role. If I had a tech who had stone heart, putting them with children usually broke that. So having them work with these really sick kids just really pulled on their heartstrings and made them a lot more compassionate. Role modeling by instructors and staff technologists. So you can role model on some patients' needs, so that you can be sure to be able to take good care of that patient. You can work with your classmates. Jill had you guys do a whole thing on giving good patient care or bad patient care, one or the other. So that's that. And review of patient interviews in which care needs are identified and response to those needs are discussed. So there are some interviews to help you guys if you're having a hard time understanding the difference between sympathy and empathy or providing proper care. There are different videos. If you need them, just let us know. Review and discuss of educational and professional materials dealing with the issues of caring. So caring is really, really important in our field. So there's communication. It's a symbolic of, it's a symbol of interaction. So your body language, your demeanor, your tone, all plays a role in the communication. So with human communication is how an individual interacts with another through symbolic or interaction or language. So health communication is a subset of human communication that is concerned with how the individual in a society seeks to maintain health and deal with health-related issues. So it's a kind of a unique set. The key elements to communication, so the speaker or the sender, that could be the imaging professional, the language spoken or body language, so explaining the procedure and asking for information from the patient, so having a dialogue, a two-way communication between the patient and yourself. The environment, so that's your imaging department, and listening, so listening to the patient, the peers, the physicians, whoever. I went in for a GI consult and the physician spoke at me, did not listen to a word I said. It was driving me crazy. So really important that you get feedback from whoever's you're talking to, and that you do listen to what people have to say. Obstacles to communication include interruptions in the flow of communication. So if you're talking to someone and explaining and the phone rings for an OR portable, so that breaks the flow of communication that you'll have with the patient. So physical noise, temperature, and other distractions, inability to see or hear, so they can't see you talking with your hands, and or if they are deaf, then they can't hear you, so they're trying to read your lips and watching your body language. So it's really important that you pronunciate everything really well for these people. Relationships concerning roles, personality, values, and ethical differences. So improving your communication by active listening. So it requires watching the patient's body language, observing the patient's physical presentation, and asking open-ended questions and waiting for the response and feedback from the patient. Most of the time, you guys will just spew out, we'll be doing a chest x-ray, it's 2 views, I want you to take off your shirt, your bra, put this on, have it open up in the back, and when you're done, just have a seat. So, can I get you a blanket? Do you have any questions? I'll be back in just a couple minutes. Will that be okay? I want you, wait right here. So, there's a difference between just talking at the person than active listening to what the patient needs. So, true active listeners strive to understand and recognize the patient needs. So, health literacy, the ability to read, understand, and act on healthcare information to make effective healthcare decisions and follow instructions for treatment. So factors contributing to health literacy. So the general literacy of the individual, the amount of experience in the healthcare system, and complexity of the information presented. There's cultural factors also that influence the communication. Below basic. So there's lots of levels of literacy. The individual poses only the simplest, most concrete literacy skills. There's basic. Individual poses only skills necessary to perform simple and everyday literacy activities. Out of every 5 adults in the U.S. reads at or below the basic literacy. Together, the below basic and below basic levels include 44% of the population, almost half of the U.S. adults. Most healthcare materials are written below the 10th grade level, most at about 5th grade. Poor communication between patients and clinicians is a major factor leading to malpractice suits. Attorneys estimate that the clinician's communication style and attitude are major factors in 75% of all malpractice suits. Is that crazy? Oof. So the legal side of caring. Caring may be the most important thing the imaging professional can do to minimize the risk of litigation. So, minimizing risk of litigation, ensuring that the patient understands the procedure. Number 1, so don't talk in this high-tech language that the patients don't understand. Ensure that the patients are able to give fully informed consent, that they understand what you're doing and they understand the pros and cons and everything of the procedure and alternatives. And the risk of doing nothing, of course. Follow procedures with the goal of obtaining maximal studies and providing minimal radiation dose. So the idea is to communicate with the patient really well so they understand, so that you can do the best job you can with the least amount of radiation while keeping the patient safe. So, apology statutes. A study in the Journal of the American Medical Association in 2003 reported after an error occurs, patients want information about how it happened, how the consequences will be mitigated, and what is being done to prevent the occurrence from happening ever again. Many states have passed litigation giving a physician the right to provide compensation statement or say, "I'm sorry," to the patient at the time of the adverse outcome without the threat of litigation. So the apology statute allows an honest and open dialogue when a medical error occurs without the apology be taken out of admission of guilt. So this is big. If the doctor who did whatever procedure on a patient and had a negative outcome, if the doctor really did explain everything to the patient and really does care about the patient and apologized, not admitting guilt, but just said, "You know what, I am so sorry this happened to you." And just that alone can mitigate a lot of cases. It's when the cover-up happens. So when the doctor covers it up or, is real aloof with the patient, it makes them mad and they sue. But if the doctor really feels sorry and, that wasn't the intent of the procedure, a lot of times people will not sue the doctor, which is quite interesting. All right. So that sums it up. That's your caring and communication for this week.